Parasympathomimetic drugs are used in the treatment of glaucoma. Glaucoma is a disease that is characterized by an increased intraocular pressure in the eye. The direct acting muscarinic stimulants and cholinesterase inhibitors reduces the intraocular pressure by causing the contraction of ciliary muscles. These ciliary muscles are present here. The contraction of these ciliary muscles facilitates the outflow of aqueous humor, and they perhaps by also diminishing the rate of its secretion. And the outflow of aqueous humor, it causes a reduction in the intraocular pressure, which is a beneficial effect in the setting of glaucoma. In the past, glaucoma was treated with either direct agonist, for example, pilocarpine or carbachol, or cholinesterase inhibitors, which includes ecothiopate or physostigmine. But now, for chronic glaucoma, these drugs have been largely replaced by the topical beta blockers and prostaglandin derivatives. In the GID, the disorders that involve the depression of the smooth muscles, as the smooth muscles of the GID tract, they are innervated by the muscarinic receptors. So all those disorders that involve the depression of smooth muscles without any obstruction, cholinomimetic drugs with either direct or indirect muscarinic activity, they may be helpful. Like there has to be no obstruction in the GID, and only the depression of smooth muscle that has caused a decreased motility. We use sympathomimetic drugs in those conditions. So these disorders, they include post-operative ileus or congenital megacolon. In both these conditions, there is depression of the smooth muscles and there is no obstruction. You have to rule out the obstruction first before administering or before prescribing any parasympathomimetic drugs. These drugs, they are also used to increase the tone of lower esophageal sphincter in patients with the reflux esophagitis. So in the choline esterase, bethanechol is most widely used for these issues. And for paralytic ileus, we can use neostigmine. Both these drugs, they will increase the motility of the GIT. Parasympathomimetic drugs are still the mainstay of treatment in myasthenia gravis. Myasthenia gravis is an autoimmune disease that affects skeletal muscle neuromuscular junctions. In this disease, the antibodies are produced against the main immunogenic region, which is found in the nicotinic receptors. So this is a patient with myasthenia gravis. I'm going to zoom this picture. So this is the patient with myasthenia gravis, and these are the nicotinic receptors present on the muscle in the neuromuscular junction. So these, in the setting of myasthenia gravis, antibodies are formed against these nicotinic receptors, and these antibodies, they attacked on the nicotinic receptors, and as a result there is a loss of the tone of the muscle. So in the setting of myasthenia gravis, the parasympathomimetic drugs, they are still the mainstay of the therapy. In the setting of myasthenia gravis, cholinesterase inhibitors are used for the treatment of myasthenia, and these drugs includes so all these drugs, physostigmine, neostigmine, and pyridostigmine, they are routinely used for the treatment of myasthenia gravis. There is another drug which is cholinesterase inhibitor, edrophonium. It has a valuable place for the diagnosis of the myasthenia gravis. What we do is that we administer a dose of 2 milligram of this drug, and it is injected intravenously after a baseline muscle strength has been measured. If no reaction occurs after 45 seconds, we give an additional 8 milligram of atrophonium. So, if the patient has myasthenia gravis, an improvement in muscle strength that lasts about 5 minutes can usually be observed. So, this is a very important drug in the use in the diagnosis of the myasthenia gravis. What you do that you give the drug and you check the muscle strength. And if there is an improvement for about 5 minutes, then that it confirms that the patient has myasthenia gravis. Urinary retention is a very common effect that occurs after post-operatively or postpartum, or it may be secondary to the spinal cord injury. And in both these conditions, parasympathomimetic drugs are very valuable in the treatment of urinary retention. So this was all about the parasympathomimetic drugs. Stay tuned for upcoming videos.